this stretch flow is great for anyone that has tightness around the quads and the patella, the infrapatellar tendon. Great for anyone who's doing a lot of sports that involves a lot of lunging, if you have knee pain when you're squatting, general tightness around the front of the knee. So to start off with, this is a controlled articular rotation for the knee joint. You're going to bend the knee, then you want to try and turn the lower leg, the shin bone, as much as possible. The mistake to make would be moving the foot a lot, but not actually getting the shin to turn. So the way that I like to do it is straighten the knee, bend the knee, rotate, rotate, and then move the joint like this. It just warms the joint up, get some of the deeper intrinsic muscles of the knee activated. You can also do it seated on a chair if you find it not that comfortable to do it on the ground. You can do 5, 6 rounds of that to get the knee started. Then go into a side lying quad stretch. So lying on the side, bend the knee and slightly extend the hip this way. And then just hold in a gentle stretch. Quads like light, easy stretching rather than too forceful. A good couple of minutes is a good idea. You can then rotate, which creates different angles. There's 4 quadricep muscles, so moving them to different angles is always a good move. And then the other thing that you can play around with is lightly kicking out into your own hand for a count of 10, and then trying to actively pull your own heel into your glute by letting go of the supporting hand and holding, and then coming back into the stretch. So the full flow would be 1 to 2 minutes holding the stretch, moving around, and then a 10-second kick out, and then a hold in, and then you'll tend to find the muscle releases quite well, which is going to take a lot of tension away from the knee. I'm going to swap legs. Obviously, you would keep doing it on the same leg if there was one knee that was problematic. Coming then into a hamstring stretch to address the tissue back behind the knee. Holding in this position, and then also adding rotation to get the medial and the lateral heads of the hamstring. If you find it uncomfortable to grab behind the knee, you could grab a towel around the back of the knee or over the top of the foot. The hamstrings, again, like a long stretch, and keeping the knee slightly bent stops it from feeling uncomfortable behind the knee, so a slight bend in the knee is good. And then again, you can play around with pressing the knee down into your own hand after a minute or two, and then trying to hold and actively pull further, and then you can passively take the tissue further. Then into a calf stretch, which is always best to do standing. Sorry to show you a view of my butt, standing against the wall. This is going to help to release a lot of the tissue around the back of the knee and take some work out of the quad as the calves free up. I like to use a little bit of rotation. Then either a massage ball, a roller, or what I have is a little Gusha tool, which you can order online, Gusha, and then just using that to work through the quads, which you could also do with the roller or the ball. And I like using the Gusha tool, especially scraping along the infrapatellar tendon, just to help increase a little bit of blood flow. So I'm just moving it up and down, which will get this tissue moving better. If you don't have that, you can also try a little bit of self-massage through the area, but the tool does tend to make it easier, especially on the tendon there. And then the last move that you can do is either just getting the knee moving by moving it through range into a squat. If you can get into a full range squat, that's great. Using some support is good as well. And then you can play around with a sissy squat if your knees feel like they can handle it. It just helps to strengthen the tendon, ideally supported. So from here, you're going to come up onto the toes, let the knees bend forward, and then go as low as is possible for you, coming out of that position. And it might just start just here, loading the tendon, and then coming back. And then as you improve the strength of the tendon and the range, you should be able to go further into that movement. But if that's too much for your knees, just stick to a normal squat. trying to get the knees coming forward over the toes, just to create a little bit of strength through the tendons, which will also help with the patella issues.